in medical clinics, and acknowledgement is an option for them. But I'm going to discuss about the alternative methods that can be suggested to such patients. Actually, producing a new generation is crucial for all species, from primitive animals to the most advanced one, human being. All the live creatures try their best to produce a healthier, stronger next generation. Lack of such in other species can lead in extinction, but in human beings, it can cause significant psychological problems. A negative pregnancy test is actually a nightmare for many families. Women are more affected by consequences of misconception. It can cause marital problems such as negligence and lack of support from husband, risk of remarriage of spouse with or without divorce, and violence by in-laws. Actually, they usually have some regret feeling, and they are exposed to unwanted questions. Finally, the main problem is anger, anxiety, and depression. These psychological problems are reported by many scientists from all around the world. What is almost common in these reports are two main psychological issues: anxiety and depression. But let me introduce the definition of infertility. In conventional medical approach, infertility is defined as inability to conceive or become pregnant after at least 12 months despite regular unprotected sexual intercourses. There should be some points to be kept in mind that after a few months, 1 to 3 months, is not considered as infertility. There should be at least 1 year of trying to become pregnant, and protection is an important point. And nowadays, for older mothers, people older than 35 or 40, some clinicians consider 6 months of lack of pregnancy as infertility as well. This problem is quite prevalent worldwide. Based on WHO reports, about 48 million couples and 186 million individuals live with infertility globally. And in developing countries, almost 1 in every 4 couples have such problems. Based on CDC in the United States, 6% of married women between 15 to 44 are suffering from infertility. Primary infertility, or infertility in a woman who has never been experienced pregnancy, is about 2%, and it is consistent in different age groups. But when you look at secondary infertility, which means infertility in somebody who has already have been pregnant, shows a significant increase by age. The global distribution of primary and secondary infertility is not homogeneous. Generally, they are both commoner in developing countries, mainly in Asia and Africa. Based on this, conventional medicine suggests a series of therapeutic methods when most of families go through one by one. They usually start from a medical approach. It means using some medicine or drugs. Then if it is indicated, they go through surgical, and the next step will be intrauterine insemination. And after that, assisted reproductive technology, or which is the common name IVF, will be used. But What about complementary and alternative medicine? I will come back to this point later, but here let me point to a simple point that um, most of patients refer to complementary and alternative medical clinics after trying the conventional ways for a series of times, and usually they have already tried all of these steps before that. To have a quick look, I don't want to go deeply in the details. There are a list of drugs used to induce pregnancy in infertile ladies. Most of them are trying to stimulate or manipulate the hypothalamus pituitary ovary uterine axis to stimulate and develop the release of eggs and prepare endometrium to accept the embryo. Surgical interventions are suggested to those suffering from congenital or acquired structural problems which can affect the process of conceptions. Here you can see some congenital anomalies in the uterus or adhesion bands which block the way sperms go to reach the ovum. All of these structural problems can be managed by surgical approaches. Intrauterine insemination, or IUI, is a low invasive intervention when washed sperm is introduced inside the uterus using fine catheters. Usually, ovulation is also induced by medication to increase the chance of conception. The next step is IVF, where mother is stimulated to release a couple of eggs. Then the eggs will be collected and transferred to lab where it is exposed to treated sperm in order to fertilize the eggs. The developed embryo will be transferred back to the womb for implantation or freeze to be used later. You can imagine how complicated and risky this process can be. Now, in case of any abnormality blocking any part of this process, donation comes in. It can be egg donation in those who cannot produce enough eggs, a sperm donation for those whose sperm is not powerful enough. In some cases that both husband and wife have some problems, embryo may be donated. Or if embryo is fine, but the uterus cannot accept the embryo and implantation has some problems, uterine donation or surrogation is the choice. And here we will concentrate more on egg donation, which is commoner in the practice, in the actual daily practice. But how expensive these protocols are. The overall money spent to treat infertility is very difficult is very different in different countries based on the health and insurance system. And it is very difficult to be counted and be measured exactly. It should be kept in mind that in usual cases, patients go through different stages one by one, and the money spent on each stage will be accumulated. So if somebody tries donation, she has already tried medical and or surgical, then she has experienced IUI, she has experienced IVF, and the money spent in overall is really huge. Based on a comprehensive report published about 10 years ago, the median cost of medical therapy is about $1,200. if they try IUI just with clomiphene citrate, which is the drug used for induction of ovulation, the price will be about $3,600. If FSH is also used as another as another drug to induce the process, the price will rise from $36 to $8,600, and IVF will cost more than $24,000. Egg donation is much more expensive. It will be $38,000. Considering another fact is very important, that none of these methods is highly successful. The success rate varies from something about 1 in 4 to slightly more than half. And it means that for a successful pregnancy, most of patients have to try each of these methods for several times, and the money spent is much higher. Finally, the cost of a treatment method to be successful could be about $6,100 for medication itself, more than $10,000 for IUI with clomiphene citrate, and near to $20,000 for IUI with FSH, and more than $60,000 for IVF, and more than $70,000 for egg donation. All mentioned so far are financial costs of the process, and it's not all. The somatic problem is really huge. Manipulation of the hormone, the main hormonal axis from hypothalamus to ovaries, can cause a long-lasting hormonal imbalance, which is really dangerous for patients. Stimulating ovaries to release eggs can cause ovarian hyperstimulation syndrome, which is sometimes lethal disease, and can cause death for some patients. By each cycle of egg collection, a huge loss happens in ovarian egg reserve pool. So the patient is pushed toward menopause. Manipulating their reproductive organs by insertion of catheters, using tools and other stuff can cause adhesion bond in the system, which can be a surgical issue. Most of the patients complain of a list of somatic side effects such as nausea, vomiting, headache, cramps, breast tenderness, etc. And the risk of multiple births is much higher in mothers went through fertility aid approaches, and this itself is a big risk factor for low birth weight, birth complications, prematurity, and many other problems which can last for a long time and can affect the family for years. Altogether, the conventional method of infertility treatment can cause extensive somatic costs for patients, in addition to previously discussed financial costs. But it is not all yet. The risk of different psychological problems is higher in such patients, such as anxiety, lack of self-esteem, depression, guilt feeling, and so on. Therefore, it is impossible to estimate the actual real cost of conventional approach to infertility. So, what is the alternation? Complementary and alternative medicine is a good choice for some cases. I have to thank Dr. Mahnaz for introducing CAM in the last presentation, and it made my presentation easier. Complementary and alternative medicine is a diverse group of therapeutic methods, which includes natural products and mind and body approaches. There are many alternative methods suggested practically used for infertility, mainly herbal medicine, acupuncture and moxibustion, cupping, homeopathy, yoga, and some other methods. Among them, I want to focus more on the use of acupuncture and its related methods in infertility. Why acupuncture? Because acupuncture is safe. Acupuncture can cause minor or no side effects in most of the patients. If any happens, it is something like minor pain, bruising, minor bleeding, and such things. Since nothing is eaten or administered to the patients, there is no risk of interaction with other drugs that the patient is actually using. Besides safety, it is effective. The efficacy of acupuncture has been evaluated by many scientists all around the world, and it has proven possible effects on a long list of medical conditions reported by WHO. Infertility is one of them. Acupuncture is relatively affordable. Each acupuncture session costs about 80 to 100 US dollars, and it is and a full course usually is less than $2,000 compared to other techniques that can cost much more. Many acupuncturists have joined the World Federation of Acupuncture and Moxibustion Society, where a set of standardized points are introduced and determined to help practitioners all around the world localize the points in a standard way. So, for example, Hegu, which is LI4 or large intestine 4, is the same point for everybody everywhere. And the differences between the individual practitioners has been much less than before. And most importantly, in my mind, acupuncture is globally available. It is practiced almost similarly all around the world, from China to the United States. And since only simple tools are used for that, what you need to treat a patient is only a set of disposable needles and an electrical stimulator. Compare it to herbal medicine, where countless of herbs and herbal preparation, which are most of the times endemic to some regions, may be used, which are different from different sources, and sometimes it's very difficult to handle it in many places. These advantages make acupuncture a suitable alternative method to focus on. Acupuncture is based on traditional Chinese medicine, which has a holistic approach to body and considers deficiencies, excesses, or imbalances in organs as a group of interrelated factors. Based on TCM, infertility can usually be due to qi stagnation, kidney yang or qi deficiency, kidney yin deficiency, liver wind fire disturbance, and some other problems. Based on the syndrome differentiation, a set of points and methods can be suggested for each patient individually, which I'm not going to discuss in details here. What I'm going to present today is the overall efficacy of this method. For this, a clinical trial done in Shiraz Integrative Medical Center will be presented here for the first time. To do this, a group of patients who were candidated for egg donation were referred by a gynecologist to acupuncture clinic. Only those who had experienced IVF failure at least once were included in the study. During a 5-year period of recruiting patients, 95 patients completed the study, which are presented here. After primary visit and syndrome differentiation, an acupuncture method was suggested to them. By explaining the procedure of acupuncture, 14 patients refused to go through the acupuncture sessions, mainly because of needle phobia. We followed them as our control group. For each patient who contributed in the study, 2 10-session courses of acupuncture was introduced by an acupuncturist. And then they were evaluated at the baseline after 1 month or 1 course, and after 2 months, which the treatment course was completed, and we continued the follow-up for another 4 months. So each patient was under follow-up for at least 6 months. We asked all the participants, either treatment group or control group, to stop any other conventional method for 6 months to see the result of acupuncture itself. For each patient, 2 hormones were measured. One was AMH, or anti-Müllerian hormone, which is the indicator of the ovarian reserve. It shows how many premature eggs are ready to be released, and if it goes down, the patient or the lady goes toward menopause. The other hormone which was measured was FSH, or follicle stimulating hormone, which is secreted from hypophyse. This one shows the response of ovaries to the hypophyseal or pituitary stimulation. The higher the FSH, the closer the patient to menopause. The acupuncture method used for a treatment group included 2 sets of points. The first group was the main points, which were used for all patients. The second group were used for individuals based on their syndrome differentiations. Since some of you may be familiar with the basics of TCM, we try to improve the kidney as well as by opening Renmai and Chongmai. We try to improve the chi movement toward the main organs that help the reproductive system. Actually, we try to stimulate Renmai in all of these patients as well. For some people who were suffering from some psychological problems, removing wind was very useful, or calming down. And in some patients, based on their chief complaints, removing of damp and improving of spleen was indicated. Let me go directly to the result of the experiments. Acupuncture after 1 and 2 months could improve ovarian reserve. After 1 and 2 months follow-ups, the AMH level showed an increase, while it was almost constant in the control group. As I mentioned before, AMH shows how many premature eggs are there in the ovaries and how many cycles of ovulations the patient can experience in her life. The other hormone, FSH, showed a significant decrease in the treatment group compared to control group, which showed a mild increase during the procedure, during the follow-up. And FSH level shows the response of ovaries to pituitary stimulation. And our results showed that ovaries are showing more and more response to the pituitary stimulation after acupuncture treatments. What is more important is the final results. Significantly, treatment caused better final outcomes. In our treatment group, more than 40% became pregnant spontaneously without any other technique during a 6-month follow-up from the start of the experiment, which was actually zero in the control group. Some of the patients had to use IVF or egg donation in treatment group, which much less compared to the control group. Half of the control group finally went through egg donation, which was only 6% in the treatment group. And more than 20% used another course of IVF, although all of them had already a set of failed ones, which was almost similar in the treatment group. What is very important for me is the psychological effect of the acupuncture treatment. About 30% or 1/3 of the control group after 6 months mentioned that they have lost their hope to become pregnant. And it was only 1% in treatment group. And it shows that treatment can make them more enthusiastic to continue their treatment and make them psychologically happier than compared to the control group. Actually, it is not the first time that positive effects of acupuncture is being reported, but as far as I know, there hasn't been any comparison between acupuncture and egg donation, and in specific groups that are almost at the end stage of the pregnancy aid techniques, which is egg donation. Bai and colleagues reviewed 13 RCTs on specific syndrome differentiation causing infertility, showing some positive effects while being safe. However, as they have mentioned, all of the studies had some weakness in designing. Also, Feng et al. Reviewed reports of efficacy of acupuncture combined with medical and interventional methods. And although the results were controversial, they showed some positive effects. And the studies are ongoing, and more recently, about a couple of months ago, Dr. Kim from South Korea has published another report on the effect of acupuncture on collection of more mature ovocytes during IVF. But in almost all of the studies, including ours, blindness is a big issue. For acupuncture studies, it is hard, if not impossible, to follow a double-blinded protocol. Therefore, placebo effect is a big possibility. So longer studies and better designs for case control studies should be considered. And most of the scientists working on acupuncture worldwide are trying to find the best way of possible blindness to be performed during the studies. And the studies should be done in different centers worldwide to prove the efficacy and safety of the method. Before I finish, I have to thank the integrative medical clinic team who had helped me during last 5 years to treat the patients, not only infertility patients, but other medical conditions. And without them, it was impossible to run any experiments or any therapeutic way. Also, I have to thank Dr. Sogan, our head of the center, who has helped me to do and perform and plan for the study, and also Dr. Alamtaj, who helped me to recruit the patients for the study. Thank you very much, and I'm ready to have any questions.
Thank you so much, Dr. Mehdi. Shall I have a question?
Sure.
Thank you. Actually, it was so interesting. May I know how many sessions and frequencies was for the treatment period, which was successful for the patients?
Okay, thank you very much. It's a very nice point that you mentioned. Um, as you mentioned in your own presentation, the medicine is going to be individualized, and for each individual person, the treatment may be different. What I presented today were those selected cases that went through 20 sessions in two sets of 10 sessions during 2 months. And it was about 2 sessions per week. But we had some patients who became pregnant or lost the study earlier, who needed less than those 10 sessions, and we had some patients who continued the acupuncture for another 1 or 2 courses to get the results. So for each patient it is different, but for this presentation I just focused on those who continued the study for 2 months.
All right, thank you. And may I know, is there any studies about the effect of massage therapy? Because, acupuncture, I'm not specialized actually in acupuncture, but as I know, it's by using needles, right? This
Yes,
type of acupuncture which you have used is by needles, correct?
needles.
So,
Yes,
is
it
there
is.
any other treatments? Because as we know in traditional medicine, the massage therapy is also another conventional therapies for different kind of diseases. May I know whether you have any information about the massage therapy also?
And there are some sub systems of acupuncture which are mainly named as reflexology, which focuses on specific areas or specific methods like massage or doing some specific stimulation or other things in specific areas, and that can be used. Of course, as far as I know, none of them is as effective as acupuncture, but we sometimes combine them with our practice. For example, sometimes we add auricular or acupuncture of ear to the treatment for some cases. Sometimes we add cupping. Cupping is very usual to be added, and also massage is a good treatment as a complementary treatment, better to say, which can be used for patients.
All right, thank you. And just another brief question. It was so interesting that you mentioned about the removing wind and damp. So just can you please briefly explain about it? What do you mean by removing them, and also about the reducing the qi or chi from kidney? Thank you.
Okay, it needs some deeper knowledge of traditional Chinese medicine. Based on traditional Chinese medicine, the material which we receive from environment, mainly food, water, air, and the energy or chi that we receive from the environment by eating, by drinking, and by being exposed to the different items, being exposed to air and so on, can affect our body, and our body has to manage it and actually digest each of them and move it inside the body. So if any problems come in, and for example, if body cannot manage the water and blood circulation in the body, it will be collected in some areas, and we call it damp, and it can cause edema, which can be seen or maybe invisible. And damp is a major problem that can stop the circulation of energy and circulation of the material inside the body. Another factor is wind. Wind can be inside the body or from outside. The wind, just to have an idea, wind can cause agitation and anxiety. Wind is sometimes that your pain is moving from one side to another. We call it migratory pain. And all of these are some indicators of the wind, which can be external wind from outside the body, or internal wind, which can cause some problems, mainly psychological problems. And all of these factors can affect our health. In this special case, we are focusing on reproductive health. The external or internal wind and collection of damp can stop our reproductive system from working properly. So by some points and some methods in acupuncture, we can remove it from the body, or we can help for a better circulation of air and material and water inside the body, to remove damp and remove wind.
Thank you so
Maybe
much for
it's
your
clear.
informative explanations. Thank you.
Thank you very much.